Hello and welcome. I'm Dr. Stephen Goldberg, Chairman of the Department of Obstetrics and Gynecology at Old Bridge Medical Center and Raritan Bay Medical Center. October is Breast Health Month, a good time to emphasize the importance of something that can truly save lives, mammograms. Joining me today are Dr. Preeti Subhedar, who is the Chief of Breast Surgery for Hackensack Meridian Health Central Region, and Evelen Faustin, the lead mammography technologist at Old Bridge Medical Center. Almost a year ago, new guidelines were announced recommending that women begin mammograms at age 40 instead of age 50. We're here to break down today what that means for your health. The latest screening recommendation is especially important for women who are at risk for cancer, including women who have dense breasts. Let's begin with why the screening guidelines shifted to start at age 40 instead of age 50. The data is clear. Starting mammograms at age 40 helps catch breast cancers earlier, when it's most treatable. This update brings national guidelines in line with what many of us in women's health have advised for years. And in New Jersey, where we see higher than average rates of breast cancer, around 7,000 new cases a year, this recommendation is especially important. Evelen, when women come in for a mammogram, what can they expect?
Well, the process is fast, usually about 20 minutes. We begin by collecting the patient's history. The history takes longer than the mammogram. Our hospital uses 3D with artificial intelligence mammography equipment, which give us multiple image layers of the breast, making it easier to find small or hidden cancers, especially in women with dense breast tissue. That means fewer false alarms and better accuracy. With pain being the #1 complaint during mammograms, we now use smart curved paddles, which contour to the breast shape, so it's more comfortable than the old flat paddles.
Dr. Subhedar, please explain to our viewers why dense breast requires more detailed examination. Why is it something women should be aware of?
Nearly half of women over 40 have dense breasts. It's normal, but it makes cancers harder to detect on traditional mammograms. Since tumors look like white spots on a traditional mammogram, it's a challenge to distinguish them from dense breast tissue because it appears white as well.
And that's where 3D or digital breast tomosynthesis imaging really helps. DBT acquires multiple images of the breast at different angles as the X-ray tube moves in an arc and reconstructs them into slices to create a quasi-3D image. In contrast, traditional mammography takes one X-ray of the entire breast from a top view and another from a side view and creates a two-dimensional picture. And if a woman has dense breasts along with a high-risk profile, say based on family history or a prior biopsy that yielded a typical hyperplasia or lobular carcinoma in situ, LCIS results, we may recommend additional screening such as breast MRI or ultrasound. In the Hackensack Meridian Health Network, we offer advanced next-generation 3D mammography with AI, ultrasound, MRI, and minimally invasive biopsy services.
Thank you. So let's now look at what goes into making someone high risk. Doctor?
Well, several factors can raise the risk of developing breast cancer. Some predominant ones are age. Most breast cancers are diagnosed at the age of 50 or older. Genetic mutations in the BRCA1 and 2 gene, having a family history of breast cancer, and having early puberty or late menopause can also increase the risk of developing breast cancer. That's because starting menstrual periods before the age of 12 and menopause after the age of 55 exposes women to hormones for a longer period of time. These are just some of the main risk factors, but it's important to note that some women get breast cancer even if they don't have these risks. Alternatively, some women will have these risk factors and still never develop breast cancer.
We used a risk assessment tool that factors in personal and family history, previous biopsy results, age at first childbirth, use of hormones, ethnicity, and more. If a woman's lifetime risk of developing breast cancer is over 20%, we consider her high risk, and that can change the screening plan. Yearly MRIs or a referral to a genetic counselor or a breast surgeon may be recommended. Most patients get a personal risk score at their visit, so they are informed. If they need supplemental screening, we guide them through the next steps. Additionally, the patient's result letter includes the risk score and the breast density category. Patients under 19 and over 84 years old are excluded from receiving a risk score.
Now we'd like to discuss self-breast exams. Are they still important? The official guidelines from the USPSTF, the United States Preventive Services Task Force, and ACOG, the American College of Obstetrics and Gynecology, don't recommend routine self-breast exams anymore. The research hasn't shown a clear benefit, but I still encourage my patients to be aware of their bodies. If you feel something new or unusual, a lump, a change in shape, don't wait. Call your doctor. There's also a lot of misinformation regarding what can raise the risk of breast cancer. Dr. Subhedar will discuss some of the most common myths and give us the facts.
Myth number 1, a breast injury can cause breast cancer. Fact, injuries caused by car accidents or a blow to the body, for instance, can lead to pain, bruising, or bleeding, which may result in a buildup of blood in the breast known as a hematoma. Additionally, fat necrosis, or scarring of the breast tissue, can occur following an injury, surgery, or biopsy. Generally, these injuries will heal on their own with time and do not increase the risk of breast cancer. Myth number 2, finding a lump in your breast means you have breast cancer. Fact, not all breast lumps are evidence of cancer, but they should be checked by a medical provider. Myth number 3, breast pain means you have breast cancer. Fact, commonly it is not caused by breast cancer, but as with lumps, you should discuss it with your doctor and have it checked. Myth number 4, only women get breast cancer. Fact, men have breast tissue and can also get breast cancer, though it's rare. Myth number 5, you're certain to develop breast cancer if you have a family history of it. Fact, you could be at a higher risk of breast cancer, but actually, women who develop breast cancer have no family history of it.
Thank you. Final word about mammograms, Evelen?
Yes. 1 in 8 women will be diagnosed with breast cancer. In the U.S., it is estimated that 42,170 women will die from breast cancer in 2025. Don't be afraid of mammograms. We are here to make you comfortable, explain everything, and help you take control of your health. Screening at 40 really can save your life. When cancer is detected early, the 5-year survival rate is 99% compared to 30% when it is not. Talk to your doctor about your risk factors, especially if you have a family history, and don't delay the first mammogram or the others that follow. Early detection gives you more options and better outcomes.
And in New Jersey, where breast cancer affects thousands of women every year, the best step you can take is staying informed and screening early.
For more information or to schedule a mammogram, visit our website or call 732-324-5270.
Thank you, Dr. Subhedar and Evelen Faustin, for joining me today to discuss this important topic. I'm Dr. Stephen Goldberg, Chairman of the Department of Obstetrics and Gynecology at Old Bridge Medical Center and Raritan Bay Medical Center. Thank you for watching.